Hey everyone, and welcome back to the channel. Today, we're diving into a really important topic for dog owners, Cushing's disease. It's a condition that can be tricky to spot because its symptoms often look like normal signs of aging, but understanding it is key to giving your furry friend the best quality of life. So, what exactly is Cushing's disease? Technically, it's called Iperadrenocorticism. That's a mouthful, I know. It basically means the body is producing way too much of a hormone called cortisol. Now, cortisol isn't a bad guy. It's essential for managing stress, metabolism, and keeping the immune system in check. But when there's a chronic excess, it starts to cause problems. Think of it like having the body's alarm system stuck in the on position 24/7. So, what causes this cortisol overload? There are three main culprits. The most common, accounting for about 80 to 85% of cases, is called pituitary-dependent Cushing's, or PDH. This happens when a small, usually benign tumor forms on the pituitary gland in the brain. This gland then goes into overdrive, sending out too much of another hormone called ACTH, which constantly tells the adrenal glands to pump out more and more cortisol. The second cause, seen in about 15 to 20% of dogs, is adrenal-dependent Cushing's, or ADH. In this case, the problem is a tumor directly on one of the adrenal glands themselves. This tumor acts like its own little cortisol factory, producing the hormone completely on its own, ignoring any signals from the brain. Finally, there's iatrogenic Cushing's. This one is different because it's caused by us, specifically by the long-term or high-dose use of steroid medications, like prednisone, often used to treat things like allergies or autoimmune diseases. Now, let's talk about the signs. This is where it gets tricky. One of the biggest red flags is a sudden, dramatic increase in thirst and urination. We call this polyuria and polydipsia. Your dog might be asking to go out constantly or having accidents in the house. You might also notice a ravenous appetite. They act like they're starving all the time. Physically, you might see some classic changes. The most famous is the pot-belly look. This happens due to fat redistribution, an enlarged liver, and weakening of the abdominal muscles. You might also notice hair loss, usually symmetrical on both sides of the body, and the skin can become thin, fragile, and sometimes darker in color. Muscle weakness, lethargy, and excessive panting, even when it's not hot, are also common. Because cortisol suppresses the immune system, dogs with Cushing's are also prone to recurring skin and urinary tract infections. Diagnosing Cushing's is a real challenge, even for veterinarians. Why? Because stress itself raises cortisol levels. A simple blood test for cortisol isn't enough, as a stressful car ride to the vet can give a false positive. So, the diagnosis is a step-by-step process. It starts with routine blood and urine tests that might show telltale signs like high liver enzymes, high cholesterol, and diluted urine. If Cushing's is suspected, the next step is a confirmation test. The most reliable one is the low-dose dexamethasone suppression test, or LDDST. It's an 8-hour test where the dog is given a small dose of a synthetic steroid. In a healthy dog, this should signal the body to stop producing cortisol. In a dog with Cushing's, the cortisol levels remain high. Another key test is the ACTH stimulation test. This one measures how much the adrenal glands can be stimulated to produce cortisol. In a dog with Cushing's, the response is usually exaggerated and off the charts. This test is also crucial for monitoring treatment, which we'll get to in a moment. Once Cushing's is confirmed, the vet needs to figure out if it's the pituitary or adrenal form. An abdominal ultrasound is a huge help here. It allows the vet to look at the adrenal glands. If both are enlarged, it points to the pituitary form. If one is very large and the other is tiny, it suggests an adrenal tumor. Okay, so your dog has been diagnosed. What's next? The goal of treatment isn't to cure the disease, but to manage it, control the symptoms, and restore your dog's quality of life. Treatment is almost always lifelong. The most common medical treatment today is a drug called trilostane, brand name Vetaril. It works by blocking an enzyme inside the adrenal glands that's needed to produce cortisol. The great thing about trilostane is that its effect is reversible, so the dose can be carefully adjusted. But this requires very strict monitoring, The biggest risk is that the drug works too well and drops cortisol levels too low, which can lead to a dangerous condition called Addison's disease. That's why regular ACTH stimulation tests are absolutely mandatory. Your vet will perform these tests about 10 days after starting the medication, then at 1 month, and every few months for the rest of your dog's life to make sure the dose is just right. For adrenal tumors, surgery to remove the affected gland can be a curative option, but it's a major procedure. For pituitary tumors, surgery is highly specialized and only available at a few facilities worldwide. So what happens if Cushing's is left untreated? The chronic excess of cortisol can lead to serious secondary problems. One of the big ones is diabetes. Cortisol works against insulin, so the body can become insulin resistant, leading to full-blown diabetes. High blood pressure is another major risk, which can damage the kidneys, eyes, and even lead to strokes. Perhaps the most dangerous complication is a pulmonary thromboembolism, or a blood clot in the lungs. Excess cortisol makes the blood more prone to clotting, and this is often a sudden and fatal event. The constant immune suppression also leaves the dog vulnerable to all kinds of infections. The good news is that with proper diagnosis, treatment, and careful monitoring, the prognosis for dogs with Cushing's is generally good. The treatment can resolve those frustrating symptoms like excessive drinking and panting, and it allows your dog to live a happy, comfortable life for many more years. It's a complex disease, but it is manageable. If you notice any of these signs in your dog, especially if they appear together, please have a conversation with your veterinarian. Early detection and management make all the difference. Thanks so much for watching. If you found this video helpful, please give it a thumbs up and subscribe for more pet health content. See you in the next one.